My name is Dr. Joseph Lee, and I contracted COVID, and I want to share my experience with you. Before I got admitted to Huntington, I started to have fever. 4 or 5 days later, I'm not getting better. Then I seek medical help. I had a chest x-ray, which is entirely normal, and a blood test that says I'm just mildly sick. But I didn't get better. In fact, I got worse. I began to cough. I just don't feel right. So I checked in the emergency room at Huntington. They did some tests, and they say there's likely I contracted COVID. I said one thing to the doctor: get me well.
He was very sick. He was on a ventilator. It's heartbreaking. And all of us, I think, that took care of him felt very committed, but also worried.
I think people were quite concerned he might not make it, and I think that would have been devastating. It really hit home to me that the importance of keeping each other safe.
The slogan that I learned in medical school, they said an ounce of prevention is better than a pound of treatment. Prevention is always better than treatment. This is so true for COVID.
And so it's just super important for everybody to remember this is a very, very serious disease. We don't have good therapies and we don't have a vaccine. So really our only go-to position now is proper personal protective equipment, social distancing, hand washing. Of all of those, wearing a mask and observing social distance between other individuals is the most important.
A lot of people have died, a lot of young people died, a lot of healthy people have died. So it doesn't only go after older people.
You could be a spreader and not be sick with it. We are very concerned about asymptomatic spread, and that occurs in individuals who are not very sick with the virus or don't have any symptoms.
There's so many people, upwards of 40%, maybe even higher, have this disease, but they don't show any symptoms.
I think it's important that we don't let our guard down, and I know that the holidays are coming up, and that's the time we really want to be together with our loved ones and our families and friends. And again, social interactions are a normal part of being a human being, and so this is really doing something that's not even hardwired in our biology.
It truly has been hard, and it's wearing on people, and I think people are getting tired. And frankly, I think probably our mental health is being challenged. You know, we're tired, but it's going to take a really concerted group effort to get us through this, and I think we will.
I have firsthand experienced the disease, and I was very fortunate and lucky to get well because of the excellent care I received. If I say I owe my life to Huntington, that's understating what I received. It's more than that. I thank all the people, everybody who took care of me. I thank you for bringing me back.